in the proper biohazard container. Remove and dispose of your gloves and wash your hands. If you need to collect a blood specimen from another newborn, put on a new pair of gloves. Collecting a heel stick blood specimen directly on the filter paper is the method of choice. At times, you may need to consider alternative methods of collection. Refer to the current edition of CLSI Document LA4 for other collection methods that may be acceptable, if allowed by local regulations, accreditation criteria, and your institution's policy. Proper specimen handling technique is critical to ensure accurate test results. After filling all the circles, let the specimens air dry at room temperature, about 18 to 25 degrees Celsius, for at least 3 hours. Avoid temperature extremes during drying. Be sure to suspend the blood collection device horizontally during drying. Drying it vertically may result in blood flowing to one side of the circle, with the result that the specimen circle does not contain uniform analyte concentrations throughout. Ensure that the protective flap does not touch or cover the blood spots until they are completely dry. When drying specimens, do not expose them to direct sunlight, store them in plastic bags, stack them, or let them touch other surfaces. Inadequate or incorrect drying will make a specimen unsuitable for testing. Once the specimen is completely dry, close the protective flap and place it in a special envelope for transport to the screening laboratory. When you are sending more than one specimen in the transport envelope, never allow the blood spots on one card to touch another. If the blood collection card does not have a protective cover, then rotate the cards 180 degrees so the blood spots on adjacent cards do not touch. Check with your newborn screening program for additional mailing or shipping requirements, or see the guidelines for the shipment of dried blood spot specimens at this website. During transport, take care to avoid exposing the specimens to humidity or extreme heat. Climatic extremes can adversely affect the specimen's stability and analysis. Unless your screening program requires different procedures, send the thoroughly dried blood specimens to the screening laboratory within 24 hours of collection. Never wait to send 3 or 4 days' worth of specimens to the screening laboratory, as this can delay testing. If you must mail the specimens, make sure there is a pickup within a few hours. If you use a courier service, be sure to schedule a pickup in advance. Specify a time soon after the specimens are dry. Keep records of when and how specimens were sent. Remember that timing is critical. Delays in getting specimens to the screening laboratory for testing can delay the diagnosis and treatment of an affected newborn, often with disastrous results. Keep records of when results were received. Make sure that you or your institution receives all newborn screening test results from the screening laboratory in a timely manner. If any results are missing, contact the screening laboratory immediately. If follow-up is needed, assist the newborn screening follow-up program in any way possible. Ideally, institutions should have a mechanism to assure that all results have been received and that babies needing follow-up care have been located and cared for. Find out if the screening laboratory received the specimen in question, and if so, ask for the test results. If the laboratory requests a repeat specimen from that newborn, obtain it as soon as possible, unless the laboratory directs otherwise. Consult your local or regional newborn screening program for guidance on what to do about follow-up of unsuitable specimens and positive or out-of-range results, or refer to the most current edition of CLSI Document ILA27, Newborn Screening Follow-Up, for additional information on recommended follow-up activities. Besides collecting and handling specimens properly, here are other activities you can do to assure the success of newborn screening. First, keep accurate records. To do this, keep a complete specimen collection log on all newborns. This helps ensure that every baby is screened and that the laboratory's test results are received in a timely manner. It is important to record both when the specimen is collected and when it is sent to the screening laboratory. Timeliness of both steps is critical to the process of newborn screening. Also, document the screening test results in each newborn's medical record. Second, store the blood collection devices properly by placing them on their side in the original packaging. The paper, which is made from 100% cotton linters, is additive-free and has been tested extensively to ensure consistent and reproducible results. Proper storage of the blood collection device prevents filter paper compression, which may alter its performance. This is important because the filter paper is specially manufactured to ensure consistent blood absorption. When properly stored, blood collection devices are stable for up to 3 years. Always check the expiration date printed on the blood collection device. Third, prevent collection problems, which can lead to unsuitable specimens. Consult the simple spot check on the Appendix B of the document LA4. Unacceptable and poor quality specimens place an unnecessary burden on the screening facility, cause unnecessary trauma to the infant, and delay detection and treatment. Here are a few common problems and ways to avoid them. One problem is alcohol contamination of the specimen. To prevent it, let the alcohol air dry completely before puncturing the skin. Another problem is tissue fluid contamination. You can avoid this by not squeezing or milking the area around the puncture site. Collecting too little blood can cause a problem too. To correct this, remove the filter paper away from the blood drop only after the blood has soaked through completely. Check both sides of the card to be certain that the specimen is adequate. Conversely, using too much blood can create a different problem. To avoid this, don't oversaturate or apply blood to both sides of the filter paper. In this video, you've seen how to collect blood correctly to maximize the effectiveness of newborn screening. To summarize, you learned how to fill out the blood collection device form accurately, legibly, and completely on a clean, dry surface. Verify that the newborn to be screened and the patient information match. Select the safest area for puncturing the newborn's skin. Wipe the newborn's heel with 70% isopropanol alcohol and let it air dry. Puncture the skin with a sterile lancet while wearing gloves. Gently wipe off the first blood drop with a sterile gauze pad. Apply light pressure and release it until a second large drop of blood forms. Touch the printed side of the blood collection device to the blood drop without touching the skin. Carefully fill each circle with a single application of blood to create a valid specimen. Let the specimen air dry thoroughly in a horizontal position. Place the blood collection device containing dried blood with closed fold-over flap in a mailing or shipping envelope and send it within 24 hours to the screening laboratory. And finally, keep records of specimens sent, results received, and any follow-up actions completed.
Our children deserve the best start in life. We give all of our babies the best chance of early and successful treatment by completing all the required information and obtaining satisfactory blood spots on the blood collection device, and by ensuring that the specimen reaches the laboratory as soon as possible. Every person involved in newborn screening is critical to successfully identifying affected newborns and preventing the effects of these disorders. The clinician's importance in newborn screening is likely to grow. That's because tests are now available and continue to be developed that will screen for additional genetic disorders in the future, all from a single blood spot specimen.
As you've seen, accurate screening begins with you. By performing these steps carefully and accurately, you can make a difference, allowing children to lead normal lives, and in some cases, even saving lives. Although this video has presented the basics of blood collection on a specimen collection device for newborn screening, you should read completely the most current edition of the CLSI document LA4. The DVD and standard go hand in hand. This program was produced by CLSI, an organization dedicated to improving the quality of medical testing through voluntary consensus, standardization, communication, and education. For more information about CLSI and its standards, call 610-688-0100 or visit the CLSI website at www.clsi.org.
Benjamin was born January the 10th, 1990, and healthy delivery, normal boy, or so we thought. And of course they done the newborn screening, the heel test, and it was probably a week later that they called us and told us that it was abnormal. And I asked them what they tested for because I wasn't real sure. And they started naming off homocystinuria, phenylketonuria, galactosemia, things I'd never heard of. We had to take him to Atlanta when he was a week and a half old for him to do further testing to find out what he had. And they found out there that it was the homocystinuria. And they started him on B6, vitamin B6, to see if he was vitamin B6 responsive. And he was on that for till he was about 3 months old. And then they started him on the formula because he was not vitamin B6 responsive. And they started him on the low protein diet. And we started doing the powder at home, the 8056 and the HOM2, mixing his formula, which he still drinks. And when he started taking baby food, he ate veggies and fruits. He wasn't allowed any meats, which he still can eat meat. If Benjamin went off of his diet, the same things would happen as if he'd never been on his diet. It can cause the eye problems and vascular problems. He could have blood clots.
Going off his diet, that's why it's so very important that he gets tested every 6 months, because the effects wouldn't be immediate. You know, you wouldn't know that he went out and ate a hamburger. But that's why he's very responsible with his diet. He keeps up with it well. He was probably 8 when he actually started counting his protein. He was 10 when he started actually mixing his formulas. With the homocystinuria, we had reservations about having another child, so we had waited 9 years because we was indecisive about it. So we had a daughter, Brianna. She's 3 now, and she tested negative for homocystinuria.
When I take my lunch to school, I always have to pack it. We'll go out to the store and find some low-protein cheese, maybe 1 or 2 grams, and I'll take a cheese sandwich every day with a bag of chips and maybe a Little Debbie. I have to take a special formula. It's just powder and water. It's 8056 and HOM2. I have to take 80 grams of HOM2 and 20 of 8056, and it tastes really, really nasty. And I have to take pills with it to keep me from getting migraines, and vitamin B6 and betaine powder. It keeps my methionine levels down, my homocystinuria levels. And like when I go over to my friend's house for something to eat or for dinner, they always make sure I have something to eat there that's low protein. And when I spend the night at one of my friends, I always call my mom and have her help me add it up to make sure I have it right, so I won't get in trouble with the doctor. And my favorite subject's probably social studies, because we get to learn about ancient times and medieval ages And I've been a straight-A student ever since I started school. Never made a B on my report card. And I play sports. I play basketball, baseball, football, and